Professor John Mendoza joins us now in the Breakfast Studios. John, welcome to Breakfast.
Thanks, Fran.
Does this $277 million for suicide prevention programs from the government do anything to soften your criticism of the Labor government's position on mental health? You accuse Labor of lacking vision and commitment.
Well, look, any money is good to see new money coming into mental health and suicide prevention. But it doesn't change the fundamental criticisms that I've had, many others have had, of the government over its first term, and really its failure to outline in detail what its second-term agenda is going to be in mental health. There is no detail around the statements of there's more work to be done, we're going to make this a priority. The announcement yesterday, Fran, really represents a bit of a grab bag, a potpourri, if you like, of small initiatives targeting a range of areas that may impact on suicide rates, self-harm rates. They generally have attached a little bit of extra money to existing programs, and in most cases it's a very small amount of additional money. They've also tended to confuse things by throwing in monies attached to what have always been seen and labelled as purely mental health programs, and I'm referring there to the $60 million for support for carers and so forth. That's not a suicide prevention initiative. Nevertheless,
suicide prevention for many people is the sharp end of the mental health debate, the underlying fear that makes this burden of mental illness so great for many. It is a good place to start.
Well, it's a place to start, but I'd put it this way. It's really patches on a broken system. And really what the government needed to do was take hold of the Senate report recently provided on the same day that Julia Gillard took up the Prime Ministership. And it said the fundamental building block for an effective suicide prevention program is an effective mental health service. And it's really abdicated addressing any of that and outlining what it's going to do in the future.
We've now got two policies on the table from the Coalition and the government. The Coalition's policy on mental health is worth $1.5 billion, largely for youth mental health psychiatric services based around early intervention and acute care. A lot more money on the table. On that basis, does the Coalition get your support going into this campaign on mental health on quantum alone?
Well, it's got a B behind the number rather than an M. That's a good start. We need billions of dollars extra into mental health over the next decade if we're going to get to the point, as Patrick McGorry has said, we need to get to 2020 where there is equity in healthcare. If you have a mental health condition, if you have a physical health condition, you can expect about the same level of access, you can expect about the same level of quality. We're nowhere near that in Australia at the moment, and it will take sustained effort. What contrast there is between the policies when you look at them. One is really, as I said, a bit of a scattergun approach to some suicide prevention initiatives, short-term, short-fix sort of approach versus what the Coalition has really outlined in the next 4 years to build a whole new service system for all of those young people, a couple of 100,000 that simply don't get access to any care at the moment, and when mental health problems first present. That's a substantial step forward. It's not a complete reform package, but it is building a whole new service infrastructure, which is so desperately needed.
Are you surprised that the Coalition has outpointed the government in mental health here? I'm thinking particularly because the Prime Minister called you, Julia Gillard called you for a meeting after she became Prime Minister, a private meeting to canvass the issues. Given that hearing, were you hoping for more?
Absolutely. I mean, Patrick and I had a very positive, constructive meeting with with the Prime Minister, rather. It was very much in my view that it was a rapprochement from her in taking up the role, setting out a different, policy stance. We wrote back to her following that and gave further details about the issues we'd discussed. And it's disappointing to see that really no strategic approach has been taken here. The opportunity for really reshaping policy and demonstrating that there's a step change from what has preceded has not been taken up by the government. And I'm disappointed, I'm surprised. I'm also disappointed that the rhetoric about we're going to do things in our second term, we're going to expand the programs in youth mental health over time.
What, you don't believe her?
Well, we've got to see some detail, Fran. Frankly, that's not good enough. On the current funding projections that Labor has outlined for the EPIC program, this is the early psychosis program, 20 centres will cost around about $300 million to build and fund. On current funding of Labor, it'll take us until the end of this century to see those 20 centres built. That's in the 25th term of government, not the second term. The Coalition, on the other hand, has said those 20 centres, along with the 90 headspace centres, will be up, fully funded and fully operational within 4 years. Now, that's a stark contrast It's not a complete answer, as Peter Dutton and Tony Abbott know, and they've heard that from me and others. They've got to do more, and there's areas of opportunity for I think, some quick wins without spending a lot of dollars, because both parties want to stay within a pretty tight fiscal environment. So
it sounds like you don't have much truck with this kind of language about mental health in our DNA, which is how the Prime Minister was speaking yesterday. But she's under tight fiscal constraints. The opposition and the government had said that this will be a lean election campaign with no dollars added to the bottom line. Every sector wants more money. Could you see a way that the government could have funded mental health reform in the way you would have liked to fund it without blowing the budget?
Absolutely. There's several areas where the government already has funds committed, which with a little bit of policy nous, a little bit of work on the behalf of bureaucrats and ministers, we could see much better outcomes. What? Well, let's take the investment in research for a start, Fran. Research is important not only to find answers to things that we don't know, but it's also about building a more sustainable workforce. People like to go into areas where there's a balance between clinical work and community work and research. We spend about $650 million this year on medical research. Only about 8% of that goes into mental health. If we were to boost that to actually around 15%, which is what the burden of disease is for mental health and suicide issues, that would mean we'd be increasing the spending in this area by about $80 million straight up. No extra funds off the bottom line of the budget, just ensuring that mental health gets its share of the medical research budget. Similarly, if you look at community housing in your piece just before our interview, your interview pointed to the value that comes from providing supported housing. Very cheap, about $100 million will provide about 2,000 places for people with severe and chronic mental illness by giving them supported services into their homes or into public housing. Now that's a cheap buy when you compare that with a hospital bed at $1,000 a day.
And you'd think policies like that might be vote winners. Time is nearly running out for you, though. Patrick McGorry is clearly hoping there might be more from Labor in this election campaign. You've been around this business a long time. What do you think?
Look, I'd like to remain open and optimistic that there is more. I certainly got a hint from Peter Dutton last night that their health policy will contain more. I think the government has to go back to the drawing boards. Prime Minister said she wants to listen and engage constructively with experts. I haven't seen the evidence of that yet, I've got to say. And I do want them to listen to the expert advice and take it on board and act on it.
Are you seeking another meeting with the Prime Minister?
Oh, I'm always open to a meeting with the Prime Minister. Thanks, Fran.
John Mendoza, thank you very much for joining us.
Thanks.
Professor John Mendoza, a former member of the Federal Government's Mental Health Advisory Council. It's 6 minutes to 8.